Hi, I'm Dr. David Greene with the California Pain Network, where we bring you anything and everything educational for pain management. Today I'm coming to you from San Diego, and we're talking about the 3 different types of epidural steroid injections. Now, epidural injections have been done for 60 years by pain management doctors and orthopedic doctors to get pain relief from pinched nerves. And that pinched nerve may be from a herniated disc or from spinal stenosis. And it can cause sciatica, which is pain that shoots down one or both legs, and it can be burning, searing, really painful. Okay? So, over the years, there's been 3 different types of epidural injections. The first one that was invented is actually called an interlaminar epidural injection. So what you have is you have the spine here, and you can see these bumps called the spinous processes. You can feel them as bumps on your back. Next to that, you have bones called the lamina. That's a lamina, that's a lamina, so on and so forth. And between the lamina is a soft area, and that's where the needle goes for an interlaminar epidural injection. So for decades, pain doctors and orthopedic doctors would blindly place a needle into that area, and when the soft tissue, they felt they got through it, like a pressure release, that's when they would place the numbing medicine and the steroid. Now, they did work very well, but subsequent studies showed that without the modern real-time x-ray machines like fluoroscopy or ultrasound, 40% of the time the needle was misplaced and the injection was basically wasted. Okay? It doesn't happen more now because pain doctors use fluoroscopy or an ultrasound to show exactly where the needle's going. All right, so those injections are about 75 to 90% effective, which is a very high amount for pinched nerves. The second type of epidural injection was invented about 10 years ago or so, and it is placed much closer to the area of where the nerve roots are being pinched. So what you can see here is this red area is basically some of the disc herniating out, squeezing out, and pinching on this nerve root as it comes out from the spine. And it comes out through a hole here called the foramen. So the foramen is where the nerve root comes off of the spinal cord in the epidural space. It comes out this hole, and that's where the nerve root is being pinched, and that's where the steroid is placed. So it's a different way to place the needle and to get pain relief, and it's much more exact. All right? So studies have shown that you do get more pain relief from a transforaminal with a nerve root being pinched than you get from the interlaminar, but both are very effective. Okay? For the lumbar spine, most modern pain doctors are using the transforaminal variety. However, for the cervical spine, it's a whole different story. There's some significant risks with the transforaminal. Well, what's the third type of epidural injection? Well, it's very different, and it's called a caudal, C-A-U-D-A-L. So you have your lumbar spine, then you have your sacrum, and you have this little hole here called the sacral hiatus. That's where the needle goes for a caudal epidural injection. And you ask, why would you put it so low? Well, here's what happens, is the pain doctor will put the needle in here and inject a larger amount of numbing medicine and steroid. So what can happen is it migrates up, and it can go to multiple levels of the lumbar spine, as opposed to just one. So if you're just treating one level, the pain doctor will just use an interlaminar or a transforaminal. Okay? But if you're treating multiple levels, a caudal can migrate, the liquid can migrate up, the medicine, and it can get multiple levels. And that's what you can often see with spinal stenosis, is arthritis overgrows tissue. It can pinch on multiple nerve roots at the same time. So a caudal epidural can treat multiple nerve roots with just one injection. So it's very helpful. Now, what do the results show for epidurals overall? Well, all of them have between a 75 and 90% effectiveness. It may take a series of 3 injections over a period of 4 to 6 weeks to get the full effect, and that series can be repeated every few months if necessary. They've tried other medications besides steroid, cortisone. None of them work as well. Okay? So steroid is the gold standard. There are different types of steroid injection, and the risk profile of these injections has less than a 1% complication rate. Very low risk of infection, very low risk of nerve injury, very low risk of a slight transient increase in your blood sugars, which usually just goes away after a few days. Okay? So they're very helpful injections, and that's why they've stuck around for over 60 years. All right. The California Pain Network offers multiple locations in San Diego with multiple pain management doctors who accept all PPO insurances, Medicare, workers' compensation, personal injury liens, self-pay, and more. Check us out on the web at painmanagementsandiego.com. See a lot of educational information on the website and just some of our locations. Just call to find out where the others are. There's plenty of them. I'm Dr. David Greene with the California Pain Network. Your pain stops here.